talk about a specific topic. Again, per usual, I may have to fly off here because currently Lorenzo is happy hanging out on his mat, but obviously, as we all know, that could change. So sitting here with my second coffee, and I want to talk postpartum blood work because I think when I see new moms, the most common thing that I see is they're busy caring for a baby, i.e., you're not doing much for yourself, barely sleeping, all of those pieces, and you find yourself burnt out, tired, maybe extremely exhausted if you have other children, and you don't really think about yourself. And then like a year goes by or 2 years go by, and all of a sudden you're kind of like, wow, I've literally never seen a doctor for my concerns. So I'm going to give you a run through of what I recommend my patients get when it comes to blood work postpartum. And if you have any questions about the specifics, feel free to drop them below. Again, if you hop on this live a little bit late, it will be recorded and posted for you to watch at a later date. So the reason why I want to talk about this is because a lot of times I see new moms, and they might not even be new moms. Maybe they have like 3-year-olds, 4-year-olds, maybe they have 7-year-olds, and they still haven't been able to take the time to invest in their own health, invest in themselves. And what happens is they're in this state of burnout. They're pouring from an empty cup or a half empty cup. Half full, half empty. Anyways, they're pouring from an empty cup and they really have nothing else to give, but they don't have a choice because they're a mom and you have to kind of keep going. So a lot of times these women will go to their doctor and their doctors will say, you're fine, there's nothing wrong. And then they leave just feeling like, okay, well, I guess this is just what it's like to be a mom. I want to make it very clear that being a mother is not a diagnosis. Having children is not a diagnosis. There is a period of time where you're kind of in the thick of it, where things can be a lot more difficult and a lot harder to navigate. But you shouldn't be feeling like crap indefinitely. There are ways to manage that. There are things that might be going on. So when it comes to blood work, the testing I like to see in my new moms, or not even new moms, literally, like I said, you could be 7, 8 years out and you're like, I haven't had blood work in a really long time. So first things first is just doing a complete blood count, also known as a CBC. This looks at your red blood cells and your white blood cells, and just looks at, I liked it as kind of a bird's eye view of what's going on, because if there's something serious going on, it's going to be first flagged in your blood cells. If there's something going on with your blood cells, if you have an infection, if you have a frank deficiency, let's say of iron, you're going to see it in your red blood cell count. Second thing I like to see is iron. So also known as ferritin is going to look at your iron stores. Now, if you're in Canada, specifically, the units will be with a range going anywhere from 5 to like 250. Dynacare and Life Labs have different ranges, so that's why I say anywhere between. Certain labs have just different ranges, but I know Life Labs particularly goes down to 5. Why is that important? Because if your iron is really low, that is considered anemia. And so Life Labs actually won't define anemia as anything below 5. So if you could have 6 and you're not anemic, and your doctor will say you're good to go. So I think that's really important to understand what your level is. And it varies based on the lab. I'm pretty sure last time one of my patients went to Dynacare, there's actually a higher range. I don't remember off the top of my head, but they actually have a higher lower limit. So let's say it's 12. So they would classify you as anemic at 12, whereas Life Labs waits till you're down to 5. So knowing that is really important, because we want to make sure that we're getting the optimal values in the optimal range, and not just making sure you're in whatever window that particular lab has set out. So that's really important. Getting your ferritin levels up is really important. Next up is looking at specific nutrients. So I always like to look at vitamin B12. B12 is stored in your liver, so you will have B12 stores. If you're a vegetarian or vegan, you certainly want to have this measured, because vitamin B12 is not in a lot of vegetarian or vegan foods unless you're supplementing. Oftentimes we're getting it from red meat is a really great source. So for those who don't eat red meat, or you're vegetarian or vegan, that's going to be something you want tested. That can be something you can get in injections or supplement form if you prefer. One moment. Okay. Well, we have someone joining because this is real life. So we'll see how long this lasts. So next up, after B12, nutrient-wise, I really like everyone to have vitamin D tested. Vitamin D is one of the most fantastic, I actually call it a hormone rather than a vitamin or a nutrient, because it does act a lot more like a hormone than a vitamin. Vitamin D is involved in hormone signaling. It's involved in immune system support. It's involved in blood sugar regulation, you name it, vitamin D plays a role. From a fertility perspective, vitamin D plays roles in the actual acrosomal reaction. So the meeting of the sperm and the egg and the fertilization is an acrosomal reaction, and there's actually vitamin D receptors involved in that. We know in fertility in infertility, vitamin D deficiency can be a contributing factor. From a mental health perspective, we know we've heard about vitamin D and seasonal depression. And the thing with vitamin D is a lot of, do you see yourself? A lot of doctors will tell you to take 1,000 or 2,000 international units, which is typically one pill or one drop. There's a few problems with that. In my clinical experience, 1,000 to 2,000 international units, so one drop, two drop, one pill, two pills, is not nearly enough. It's not going to change your level. So if you are deficient, that's not going to change anything. And if you're not deficient and you're trying to get your levels up, it's just going to keep you exactly where you are. So that's an important thing to note. Getting your vitamin D levels tested will allow you or your practitioner to calculate the dosing you need based on weight. So that's a really important factor as well. So vitamin D is on that list. And last but not least is thyroid health. So your thyroid, especially postpartum, can develop into what's known as Hashimoto's, or an autoimmune thyroid disorder. Basically what happens, long story short, is the act of giving birth and those hormonal changes that happen after can cause kind of a rebound effect to the immune system, leaving you vulnerable to autoimmune attacks. So what does that mean? Your body basically starts to attack its own cells. In the case of Hashimoto's, we attack the thyroid gland. And so this causes inflammation, this causes symptoms. This isn't going to be caught by your typical thyroid screening done by your medical doctor. Typically, they're only looking at TSH. So one of the things I like to check postpartum, especially when there's things like anxiety, heart palpitations, trouble sleeping, we want to really differentiate between postpartum anxiety and not. But again, if you're 6, 7, 8 years out and you're having palpitations, sometimes Hashimoto's is something that goes undiagnosed, not noticed and not diagnosed because the right things weren't tested, the right factors weren't looked at. So that's something that's really important to get looked at as well. So that's kind of my run through, quick Cole's notes of what I would have tested. If you have questions, please comment below, and I hope everybody has a good day.